So now we are discussing the lower limb, LAQs. The lower limb, starting with the joints. The first joint is the hip joint, multi-axial ball and socket. Hip joint, the articulating surfaces are the acetabulum, transverse acetabular notch which is filled by transverse acetabular ligament, lunate surface of the acetabular, that is on the medial side, and on the lateral side there is the head of the femur. In the ligaments there is one capsule. If you remember, capsule is attached to the intertrochanteric line anteriorly and 1 centimeter medial to the intertrochanteric crest posteriorly. Capsule has two types of fibers. One are retinacular fibers, which run like this, and second is zona orbicularis. Zona orbicularis, which are circular fibers, vertical fibers and circular fibers. Then the ligaments of the hip joint are described as 3 plus 3. 3 plus 3. The first three come from ilium, ischium and pubis. Coming from the ilium is iliofemoral ligament. It starts from anterior, inferior iliac spine. From the anterior, inferior iliac spine. And it goes in an inverted Y-shaped way on the intertrochanteric line. Inverted Y-shaped way on the intertrochanteric line. This ligament, Shreya Putta. Sanskar, Yudhishthir, वो एक्चुअली टिंग करने को मिला, याद आता रहेगा उसको. Anterior inferior iliac spine. Bigelows ligament, the strongest ligament in the body, it prevents the trunk from falling backwards. Second is pubofemoral ligament. It starts from the iliopubic eminence, and it joins the iliofemoral ligament. Third is ischiofemoral ligament. It starts from the ischial tuberosity and it joins the zona orbicularis. Zona orbicularis are the circular fibers of the capsule. Okay? So one coming from ilium, one coming from ischium, one coming from pubis. The other three, 3 plus 3, other three are all related to the acetabular notch, which is filled by transverse acetabular ligament, so that is one. Why there is notch over here? Because we want blood vessels to go inside. So there is a space below through which the blood vessels go inside and supply the head of the femur. Running from the head of the femur to the transverse to this notch is the ligament of the head of the femur, which is also called as ligamentum teres. And then the third is the glenoidal labrum. The glenoidal labrum, which is made up of fibrocartilage. So 4, 5 and 6. 1, 2, 3, 4, 5, 6. The hip joint has following movements. Of course, the blood supply comes from the obturator artery, from the medial and lateral circumflex femoral arteries. Okay? The nerve supply is from the superior gluteal nerve, from the nerve to quadratus femoris, from the sciatic tibial part of sciatic nerve, from the sciatic nerves. The actions are flexion, extension, adduction, abduction, medial rotation, lateral rotation and circumduction. Flexion is brought by iliopsoas. Flexion is brought by iliopsoas. Extensors of the hip joint. The chief extensor is gluteus maximus and hamstrings. Gluteus maximus and hamstrings. Adduction is brought about by adductor longus, brevis, magnus and gracilis. Abductors and medial rotators are same. Gluteus medius and minimus. Okay, and the same muscles cause gluteus medius and minimus and tensor fascia lata. Like in our shoulder joint, there were short lateral rotators, infraspinatus and teres minor. Here we have the lateral rotators, and they are the obturator internus with two gamellae and quadratus femoris. And quadratus femoris. The applied anatomy, congenital dislocation of hip happens in small children. Then tuberculosis of hip joint. Then Perthes disease, this flattening. And most important nowadays, what we are seeing is avascular necrosis of hip joint. Very commonly happening nowadays, avascular necrosis of hip joint. देखो लोगों को ब्लड सप्लाई कम होने से हार्ट अटैक होता है, स्ट्रोक होता है. कुछ लोगों का ब्लड सप्लाई टू हिप जॉइंट इज कॉम्प्रोमाइज बिकॉज आपका फैटी फूड वगैरह इतना हो. दैट इज वन रीजन. देयर आर मेनी रीजंस फॉर दिस. ओके, हिप जॉइंट, नी जॉइंट, कुछ नहीं याद आया तो यू हैव टू राइट हिप जॉइंट रिप्लेसमेंट. फिर उसमें पार्शियल रिप्लेसमेंट, एसिटाबुलम या तो हेड. कंप्लीट रिप्लेसमेंट में दोनों को रिप्लेस करते हैं, एसिटाबुलम भी और हेड भी. हिप जॉइंट रिप्लेसमेंट सर्जरी. एंड द नेक्स्ट जॉइंट इज नी जॉइंट. नाउ व्हाट हैपेंस विद नी जॉइंट इज, हम लोग जब पढ़ाते थे तो हम लोग बताते थे इट इज कंपाउंड कॉम्प्लेक्स मॉडिफाइड हिंज जॉइंट which is a combination of two joints, a condylar joint between femur and tibia and a saddle joint between femur and patella. But आजकल वो डिस्क्रिप्शन में नहीं दिखता है. भैया है ऐसा लिखा है. Now the hip joint and the knee joint, when you have to draw the capsule and the main two ligaments, because it is actually a modified hinge joint. Modified hinge. Why modified hinge? Because slight rotation भी होता है. Otherwise hinge joint में rotation नहीं होता है. तो मैंने आपको बताया था यहाँ पे शाल्वर 3 लाइंस निकालना है, मीडियल साइड, लैटरल साइड. इसके जो आर्टिकुलेटिंग सरफेसेस है, सुपीरियरली lower end of femur, inferiorly tibia, condyle, and anteriorly the posterior surface of patella. So 1, 2 and 3. 3 articulating surfaces. When मैंने बोला ना मीडियल साइड पे आपको 3 लाइंस ड्रॉ करने हैं। एक है कैप्सूल और ये है मेनिस्कस, दूसरा है डीप पार्ट, तीसरा है सुपरफिशियल पार्ट ऑफ टिबियल कोलैटरल लिगामेंट। ओके, हरी आळस दिला असतो आता सुरुवातीला तो असा रेजिस्ट केलंच पण नंतर lateral side the first line is the popliteus. First line is popliteus, second line is capsule. इसमें first line is capsule medial side, the popliteus tendon is intra-articular. Okay, and the third line is fibular collateral ligament. Fibular collateral ligament. 3 लाइन्स ड्रॉ करने हैं, मीडियल साइड पे 3 लाइन्स, लैटरल साइड पे 3 लाइन्स। कैप्सूल, डीप एंड सुपरफिशियल पार्ट ऑफ टिबियल कोलैटरल लिगामेंट, popliteus on the lateral side, popliteus, capsule and fibular collateral ligament. Apart from capsule, the knee joint has 2 collateral ligaments, right? Tibial collateral and fibular collateral ligament. It has 2 thickenings of the capsule. उसमें एक है coronary ligament, which is thickening deep to the meniscus, and short lateral ligament. Short lateral ligament. This is thickening deep to the fibular collateral ligament. So 2 collaterals, 2 thickenings, 2 popliteal ligaments, arcuate popliteal and oblique popliteal. ऑब्लिक पॉप्लेटियल लिगामेंट, सेमी मेम्ब्रेनोसिस यहाँ पे इंसर्ट होता है, वहां से जाती है ऑब्लिक पॉप्लेटियल लिगामेंट, which is pierced by the middle genicular artery, which supplies the intra-articular structures of the knee joint. Middle genicular artery. Popliteal artery gives 5 branches: superior medial genicular, superior lateral genicular, inferior medial genicular, inferior lateral genicular, and middle genicular. This middle genicular pierces the oblique popliteal ligament, goes inside and supplies the intra-articular structures. What is arcuate popliteal? Arcuate popliteal is extension of the short lateral ligament. Then there are 2 menisci. 2 menisci, and there are 2 cruciate ligaments. 2 menisci and 2 cruciate ligaments. So we know that in the intercondylar area there are 3 things anteriorly, 3 things posteriorly. Medical College लातूर, लातूर वाले कौन है? लातूर मेडिकल कॉलेज। मीडियल मेनिस्कस, lateral meniscus, anterior cruciate, posterior cruciate. Okay. So in short, the knee joint has capsule and 10 pair of ligaments, 2 collaterals, tibial collateral, fibular collateral, 2 thickenings, coronary and short lateral, 2 popliteal, oblique popliteal, arcuate popliteal, two menisci, medial meniscus, lateral meniscus. Two cruciates, anterior cruciate and posterior cruciate. Anterior cruciate goes behind, gets attached to the medial surface of the lateral condyle of femur. Posterior cruciate goes anteriorly and gets attached to lateral surface of the medial condyle of femur. Anterior becomes taut during extension, posterior becomes taut during flexion. Okay? The nerve supply is again from the tibial nerve from nerve to vastus medialis, femoral nerve via nerve to vastus medialis. Sorry, femoral nerve via nerve to vastus medialis, it supplies the knee joint. Femoral nerve via nerve to rectus femoris, it supplies the hip joint. Obturator nerve, anterior division supplies the hip joint, posterior division supplies the knee joint, and tibial part of sciatic. Blood supply I have already told, branches of the popliteal artery. The actions, flexion, extension. Flexion is brought about by hamstrings and gastrocnemius and plantaris. Okay. Extension is brought about by quadriceps femoris, rectus femoris and vastus medialis, vastus intermedialis, vastus lateralis. Extension. ओके, सो जिम में जाते हैं तो लोग ऐसे बैठते हैं. जिम में जाने वाले मेरे को सुबह कभी दिखते ही नहीं इधर. कौन है इधर? मसल हसल. हाँ, तो वो जो मशीन रहता है ना जिसपे ऐसे एक्सटेंशन करते बैठ के, दैट इज फॉर quadriceps. Then there are rotations. There are two types of rotations. Conjunct rotation and adjunct rotation. याद आ रहा है? Adjunct rotations are the independent rotations which takes place in a semi-flexed knee joint. Medial rotation and lateral. Medial brought about by semimembranosus, semitendinosus. Lateral brought about by biceps femoris. So that is adjunct, independent. Solani barabar na? And conjunct is accompanied during locking and unlocking of the knee joint. In the final stage of the extension, there is medial rotation of the femur or the tibia. The knee joint gets locked. Medial rotation. Suppose I are talking about the right knee joint. And unlocked by popliteus, which is attached here on the lateral side. Unlocks. So there is lateral rotation and then extension. So then flexion. So extension. Medial rotation of femur locking. Lateral rotation of femur unlocking and then flexion. Okay. Applied anatomy. और एक अप्लाइड एनाटॉमी आपको मैं बताता हूँ. इधर आएगा जेनु वेरस, जेनु वाल्गम, वाल्गस, वेरम एंड वाल्गस. ओके. क्यूबाइटल, व्हाट इज क्यूबाइटल वाल्गस? Going away. So valgus is always away, varus is towards. So genu verum will be like this, knock me. Genu valgus will be like this, bony. Then कुछ नहीं याद आ रहा है आपको, knee replacement, osteoarthritis, chronic osteoarthritis. Knee joint is chronically affected by osteoarthritis in obese, overweight people. Okay. Then meniscal injury, very common. meniscal injury, meniscal tear, cruciate ligament tear, orthoscopic repair. So that's all about knee joint. एंड कुछ नहीं यार, नी रिप्लेसमेंट तो है ही हमको, नी रिप्लेसमेंट होता ही रहता है लोग. आपके आजकल एल्डरली जरा सा 50 के ऊपर की कोई आपके आंटी ऑन तो रहेंगे तो वो बताए आताच नी रिप्लेसमेंट झालं शिवेटली केलं ते पुण्यामध्ये दीनानाथ मंगेशकर. सो दिस इज वेरी कॉमन नाउडेज. ओके, यंग एज में आपको कुछ नहीं होगा बिकॉज ऑफ वेट, बट देन आफ्टर 40-45 we should, by then you should get back to your fitness, because the lot of friction happens between femur and tibia. TNMC BHOSALE हम लोग का जो सर ने स्कूल में रजिस्टर्ड किया रहता है ना, उधर ऑलरेडी हम लोग का कनाडा यूएस में इज्जत जाता है, मिस्टर भोसे. तो नेक्स्ट जॉइंट इज एंकल जॉइंट. अगेन अ हिंज जॉइंट. हिंज जॉइंट. Ankle joint articular surface is formed superiorly by the lower part of the tibia, inner part of the medial malleolus, inner part of the lateral malleolus, and lower inferior articular surface is formed by the medial, superior and lateral part of the talus. There is talus, below the talus is calcaneus. And then there are two ligaments. There is medial ligament which is called as lateral ligament, and then which is called deltoid ligament and lateral ligament. Sorry. Now let us study the medial or deltoid ligament. This is the medial malleolus. From the medial malleolus, which is the tibia, there are following three components. There is superficial part and there is deep part. In the superficial part, there is tibio-navicular. Tibio-navicular. In the middle part, there is tibio-calcaneal fibers. Tibio-calcaneal. And then there is posterior tibio-talar. Posterior tibio-talar. So the medial ligament, also called as deltoid ligament, okay, right, also called as deltoid ligament, has superficial part and deep part. The superficial part has three components: tibio-navicular anteriorly, tibio-calcaneal in middle, and posterior tibio-talar. And deep part has anterior tibio-talar, anterior tibio-talar, anterior tibio-talar. Okay. So this is medial ligament, also called as deltoid ligament. Laterally, there is fibula, and it has three components. Laterally, there is fibula, and it has three components. Anterior talofibular, posterior talofibular, and calcaneofibular. And calcaneofibular. Anterior talofibular, posterior talofibular, and calcaneofibular. three components of lateral ligament. Actions are only two: flexion and extension. ओके, आपको कुछ भी इधर याद नहीं आ रहा है, क्या फ्लेक्शन करता है, क्या एक्सटेंशन करता है. Tibialis posterior will cause flexion, tibialis anterior will cause extension. फिर आपको याद आने लगेगा, हाँ तो tibialis anterior के साथ यहाँ पे और मसल्स है, क्या है, extensor pollicis, extensor digitorum, the anterior compartment of the leg which is supplied by deep peroneal. ऐसे कैसे आ सकते तुम? Then tibialis posterior, but उससे भी पहले most important gastrocnemius and soleus. तुझं नाव काय रे? सेकंड लास्ट बेंच. सेकंड लास्ट बेंच, जो बैठा हुआ लड़का ऐसा ऐसा कर रहा है, जो मसल हसल में आता है, हितिशा के बाजू में बैठा है, जिसका केस कुरळे है, चश्मा डाला है, क्या नाम? सिद्धार्थ. बस इतना सब डिस्क्रिप्शन दे रहा हूँ, मेरा रोड वाले के पीछे बैठा है. अरे वो तुमको बता नहीं था, जिम में जो अपन कंधे पे ये लेके ऐसा ऐसा करते हैं ना, दैट इज फॉर gastrocnemius and soleus exclusive. So वो जब करेंगे तो these two muscles they become bulky. Other option is हील वाले, जो एक्स्ट्रा हील के जो ये पहनते हैं एकदम, उनको हाँ, you will take this as a homework कि females using high heel footwear, whether their gastrocnemius and soleus develops well or not. Okay, gastrocnemius soleus. फिर इसके साथ आपको लगा ये दरअसल कम है, तो tibialis posterior के साथ क्या रहता है, और flexor pollicis, flexor digitorum. Okay, एंकल जॉइंट में अप्लाइड एनाटॉमी में क्या लिखोगे? हाँ, डिसलोकेशन से भी ना, the fracture normally happens when the leg gets twisted. These two ligaments are so strong that the malleolus breaks. So उसको Pott's fracture बोलते हैं. And sprain on the ankle ligament. बांधल, पहिलं नाव काय? वैष्णवी. काय मराठीमध्ये एकदम महाराष्ट्रामधला सगळ्यात टिपिकल शब्द, पाय मुरगळला. लोटून असं झालं आणि पाय मुरगळला. फ्रॅक्चर नाही आहे, पण डॉक्टर म्हणतात की सूज आली. तो ये सब जो डिस्क्रिप्शन है ना, मतलब some fibers of either the medial ligament or the lateral ligament are torn. When the fibers are torn, a person is not the same for next 15-20 days. फिर उसको क्रेप बैंडेज डाल के वो फिर धीरे धीरे जैसे वो लिगामेंट हील हो जाता है. So sprain, we cannot say पाय मुरगळला वगैरह. It's some fibers, tear in the fibers, ankle sprain जिसको बोलते हैं. Okay, so in applied anatomy it's very common because of because of excessive inversion, very common. while walking on uneven surface. Eversion ऐसा rarely होता है, but inversion is very common ऐसा. While walking, running, playing. Okay. Let's stop here.